Good morning, everyone. Thanks for joining us. It's my pleasure to introduce today's presentation. Dr. Sneha Venkatraman graduated from Vanderbilt University, where she received a Bachelor's of Arts degree in Psychology and Medicine, Health, and Society. She then completed her medical training at the University of Tennessee Health Science campus in Memphis. Journeying out west, she completed her psychiatry residency at the University of Arizona in Tucson, where she served as a chief resident. At the UCLA Child and Adolescent Psychiatry Fellowship, she has loved learning from the expertise of her mentors and supervisors in such a supportive environment. She is currently in the fellowship clinician educator area of distinction led by Dr. Jessica Jeffrey and me. While at the University of Arizona, she completed the Integrative Medicine and Residency Psychiatry track and Advanced Integrative track, where she saw children and adults in the Integrative Psychiatry Clinic. These training experiences furthered her interest in working with patients in a comprehensive way that reflects the biopsychosocial formulation and treatment planning. She's currently completing the Integrative Psychiatry Institute year-long fellowship program to understand more about the evidence base for many modalities and ways to incorporate them clinically. And with that, Dr. Venkatraman.
Thank you so much, Dr. Ramos, for that kind introduction. Let me pull up my presentation. Right. So today we will be talking about an integrative approach to child and adolescent psychiatry and delving into the role of nutrition and supplementation in ADHD. I'm so excited to be here today, and I want to call out to the question and answer section later in this hour. So honored to have Dr. Nosheen Ranjbar, our special guest speaker and an incredible mentor, here with us today, and much more to come about her amazing work. So stay tuned. She's also here to help facilitate the discussion at the end of the presentation. So please send questions during the presentation. All right, here are the disclosures. Neither of us have received anything for any brands or supplements or pharmaceuticals, which will be relevant in the presentation later. All right, goals and objectives, but I want to go over into our next slide, which is our roadmap. And we'll be starting with an overview of integrative psychiatry, providing a basic clinical framework for integrative care and to share some of the resources in case you want to bring this into your practice. And then we'll turn to ADHD as an example. Reasons why integrative treatment might be especially important for ADHD. We know medications and therapy can be so effective for a lot of patients, but there are some that continue to struggle even with the best treatment. Specifically, we'll be talking more about nutrition and supplement intervention, and then wrap up for our discussion. All right, so diving into integrative psychiatry. As you can see in this striking image here, there's so many factors that have the potential to be addressed in mental health treatment. And at its core, how I like to think about integrative psychiatry is bringing in this biopsychosocial model that we all have learned about, our rich, complex formulation, into the treatment plan so that it can be as comprehensive and address as many factors as possible. And importantly, it's not just complementary and alternative medicine or CAM. It's bringing together the evidence base for our conventional practice and CAM to extend what we have to offer rather than limiting. So I think of integrative psychiatry not as a tool, but a way or a mindset in which to approach patient care, individualized and not one size fits all. According to the Academic Consortium for Integrative Medicine and Health, Integrative Medicine and Health reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals and disciplines to achieve optimal health and healing. And as you can see, the definition is quite broad, and the label is not important. Integrative psychiatry can just as easily be called holistic mental health care, precision medicine. I call it comprehensive treatment planning, or just psychiatry. And one of the many reasons child psychiatry appealed to me is that those in this field already often practice this way, incorporating the environment, schools, families into the work, working on physical activity, coping skills, bringing all of this into our practice. The integrative approach also calls on its practitioners to commit themselves to self-development, to have this lived experience of what it's like to learn these modalities and to use these skills yourself as a way to bring deeper connection and meaning to your work. And here is my reason for presenting on this topic today. Integrative psychiatry allows me to practice for my values and reasons for going into medicine. Do no harm is something really important to me, and being very intentional, especially with treatments and assessing risks and benefits of those that can have significant side effects is important. Is this medication or supplement helping enough? Are there any medications that have been left on that maybe should be reassessed? Helping patients thrive is another one. With the current practice of psychiatry, we often get a good response to treatment, but how often do we work towards remission and preventing recurrence? It is often by bringing in these lifestyle measures and values, by getting to these root causes. And so I encourage you to reflect on what is most important to you in your practice with patients. What does practicing from your values look like for you? And this gets at the spirit of integrative psychiatry, bringing your full self into patient care. And here are some other reasons for the presentation today. We'll be getting into the reasons of why CAM might be used later for ADHD specifically, but we see our patients are wanting to know more about these modalities, and it's more commonly used when there are mental health issues. Herbal supplements are the most common, which is a reason that we'll be focusing on nutrition and supplementation today. I also want to look into cultural considerations that beliefs about mental health can influence desire readiness for different aspects of treatment. So it's important to provide psychoeducation for a medication when indicated, while also being able to use other tools in our toolbox. And this may include working with patients in a way that makes sense to their culture, values, and beliefs, and to acknowledge the cookie cutter approach isn't fit for all of our families. And we know also that patients often don't share CAM use with their doctors. So on the patient side, there is a perception that physicians in the US maybe don't practice or have knowledge in these other modalities, so might not be brought into the appointment. And on the practitioner side, there are limited training opportunities. What if we had more training? Then maybe we would feel more comfortable and confident counseling on these other modalities. When we counsel patients on treatment, we aim to share risks, benefits, and alternatives. So learning about the alternatives is important. And so that's another reason for this presentation, to provide a little bit more information on some of these other modalities and how to employ them clinically. Putting all of this together, you can imagine that having an integrative mental health approach can look different for each patient and each clinician. So it might be helpful to get a broad overview of what this might look like. Here are some aspects that I want to highlight. Creating a sense of connection, taking just a moment to reflect during the intake on why you went into psychiatry or mental health, something you might learn from this encounter, why this work is meaningful to you, and taking a moment to pray for patients' well-being, for those that are spiritual, or sending them well wishes. So I encourage you now and invite you to take a moment to send a well wish to someone right now, someone in your life, a patient that you've seen this morning or will be seeing today, and have this experience of what this can be like. All right, and as we know, that patients being motivated towards treatment can be a huge factor. For example, when we think about treatments for mild depression, we may go with an SSRI or CBT, and it really depends on the patient's desire to participate in CBT. Some of these integrative modalities are similar, like setting a regular exercise regimen, working on nutrition. Meditation can take a really big commitment. So having patients that are motivated towards that type of treatment and value it can be really important. As you can imagine, there are so many factors that can be worked through as well, that throwing them all in from the initial treatment plan can be overwhelming. So assessing where to start and adding on as you go through your, with your clinical judgment is also important. So I'm going to get into some of these extra pieces that we might cover in integrative intake as well, in addition to what we do usually. You might review nutrition and supplements in a little bit more detail. Nutrition might look like, what did you eat in the last 24 hours? Maybe asking patients to journal and bring in a food diary over the last couple of days. Have they noticed a relationship between what they ate and energy? Asking about supplements. Well, when inquiring about supplements, we might ask, do you take any supplements that are over the counter or that you purchase online? Any vitamins, minerals? Could you bring them in to your next appointment so that we can review them together? For spirituality, this might look like, do you have spiritual beliefs that help you cope with stress? And what gives your life meaning? How would you like to address these issues in your mental health care? And looking at working in an integrative way, we often bring in a strength-based approach into the interview. Sensitive asking, what brings them in today, starting from a whole person approach and getting to know them. So might ask things of the parent, what are 3 things that you love about your child? For asking to a child, if you could have 3 wishes, what would you wish for? Who can you count on? When people or best friends say good things about you, what are they likely to say? Describe the most recent good day you remember. What made it good? When things are going well in life, what was different? So we incorporate a lot of this as well into our intakes, and expanding on this can be helpful. All right. And just an example of what treatment planning can look like. There are a lot of things you can consider, like working with the system, like as we usually do, looking at who the child lives with, their spiritual community, maybe role-playing school or work situations, and connecting teachers. And for nutrition, we had asked on supplements, we had asked about if the patient could bring them into the next appointment. So now they've brought them in and you're looking at the labels. So what might you do next? I wanted to share some resources that we have. Our gold standard natural medicines database, it is available in the UCLA library. And it can be quite balanced, shares when things are not effective or could be harmful in interactions, and also things that do have good evidence as well. Examine's another great one. It links you right to the research that they're using to come up with a recommendation, so you can look at it yourself. Some other resources here. Medscape has a great drug interaction checker that goes over over-the-counter things, herbal supplements. Mytivin also, you can type in a medication and see if it affects any of the nutrients in your body, things to look out for. And so diving in to an integrative approach to ADHD. So current standards for ADHD in youth are using medications, maybe adding on things like behavioral therapy, classroom modifications, and parent training. And as we know, all of this can be so effective. And sometimes it can be challenging to access high quality care quickly as well. So this is where some of the integrative treatment can come in. We know ADHD is common and impairing, and it's really important to treat and decrease comorbidities and risks. More than half of children with ADHD have learning or mental health comorbidities, and oppositional disorder is often present. About 25 to 45% with emotional dysregulation. That those that come to attention of mental health, often it might be higher because our PCPs might be seeing patients that are more straightforward and easily treated. So that this might be higher in the presentation with mental health. And that can be where the modalities that treat both ADHD and some of these comorbidities come into play. And we see that even with the best treatment, like the intensive behavioral services and medication management, seen the multimodal treatment study of children with ADHD, that 32% were still symptomatic. And they set a high standard. It was looking at the SNAP scores, and they had to average just a little on each item of ADHD or lower. But this is really the target, right? Like getting our patients to remission. And the number is higher as we'd expect for just medications. And often we do have to rely on medication management because of lack of resources, and a greater number of children continue to have ADHD symptoms. And sometimes getting to the optimal doses and medications can be hard too. When side effects come up or due to patient or family preference, they might ask for other treatments for ADHD. So in addition to psychoeducation and sharing more about medications and what they can help with, augmenting and complementing with other modalities becomes even more important. So what do we know about CAM use in ADHD? We know that 1 out of 5 children and families reported to use CAM in 2017 in the National Health Interview Survey. They also looked at 2012 data, so these numbers might be higher by now. But that these trends also showed that kids with ADHD were more likely to use CAM, and that children with ADHD and comorbidities were even more likely to use CAM. So reasons that were mentioned is that augmentation with CAM often helped treat ADHD symptoms when added to conventional treatments like medication. The focus on the whole person, they felt it was natural, part of their upbringing, that treats causes and not just the symptoms. And that 72% did not disclose CAM use to their PCP and gave the reasons that PCP did not ask or did not feel that it was important to know. So it is important to ask and get a little bit more information about what other modalities may be used in treatment. Right, here's a very broad overview. A lot of these things have been looked at for their use in ADHD, and not all are evidence-based. And in fact, some have been shown to not be helpful. But you can see there's a lot of things on here. So diving into nutrition and ADHD. So this slide looks at the diet for almost 34,000 kids. And we see in the first column that the ultra-processed foods percentage has gone up in the last 20 years. This includes things like high fructose corn syrup, flavoring agents. I think of sweetened drinks, breakfast cereals, things that are ready to eat from frozen section of the supermarket, and that's gone up. And for whole foods, we see that it's gone down the percentage over the last 20 years. And these include things like that are not processed or refined, not fragmented, and known to be healthier options, like things like fruits and vegetables and nuts. And so we get a lot of questions about nutrition and ADHD, and we don't have all the answers. But there are some studies in ADHD nutrition, and it could be helpful to look at. So there was seen an association between low adherence to the Mediterranean diet and ADHD, which in the Mediterranean diet incorporates a lot of whole foods. Also saw that ADHD was associated with high consumption of sugar, candy, and soft drinks, and that skipping breakfast and eating at fast food restaurants as well was associated with ADHD. The last point here looked at a prospective study following almost 3,000 kids in Australia, and from 0 to 14 years. And the ones that are continued to be in the study, they saw that 115 had ADHD, and then took data at that 14-year point. And use some regression analyses and try to control for other things, but they saw that the kids with ADHD ate more fat, sugar, refined carbs, salt, and less omega-3s, folates, and fibers. And there was also kids who ate most takeout food, potato chips and soda, also had more ADHD. So there wasn't much in terms of specific foods within this Western dietary pattern that showed significant relationships with ADHD. And it was seen that it can be important to examine the total dietary intake, that was more important. So what do we know? That kids are not eating well, and that kids with ADHD are eating even worse. So why could this be? We know that ADHD kids can lead to higher impulsivity, that it might be harder to eat foods that are not as preferred. We also know that stimulants really mess with the appetite, and parents might be just trying to get in calories. So those could certainly be factors. We also know that ADHD is highly heritable, and that we can't change the genes, but maybe we can look at nutrition. More studies are needed on nutrition, and it's important that nutrition is not a cause of ADHD, but it's possible that diet factors can worsen behavioral symptoms. And that's not well studied, but a theory that's proposed in this paper is that it was bidirectional, that ADHD certainly worsens food patterns, but that maybe eating that way can somehow contribute to behavioral symptoms as well. In adults with depression, it is well studied how whole foods in the Mediterranean diet can affect mood. But we don't know enough yet about how or why. There's a theory that the Mediterranean diet changes the gut microflora, which then influences the gut-brain axis. But what can we take away? Maybe to make sure our ADHD kids are prioritizing nutritious food, as they are more likely not to. ADHD is also associated with binge eating and obesity. And to get more of these whole foods in that we know to be healthy can be helpful. And if there is co-occurring mood issues, it might be especially important to eat this way. So here's some examples of whole or minimally processed foods. They can be things especially helpful for when stimulants are wearing off and you need a quick snack that can be nutritious and healthy. Some sweeteners that are more less processed as well. We know that just cutting out sugar doesn't seem to make a difference in ADHD symptoms, but that if it's less processed, that might be helpful for overall health. There's also some studies on attention in eating breakfast. So there was a randomized controlled trial with kids and then adolescents where they looked at a low glycemic index for breakfast, and the kids that ate the lower glycemic breakfast had better executive functioning, working memory, and attention compared to a higher glycemic index or skipping breakfast. Not specific to ADHD, but maybe a little bit more relevant to kids with ADHD and their care. And the last one, high protein meals and snacks, there's less data, but that might be a helpful way to get in more of those low glycemic index foods in for kids. So here are some other practical tips that these can often be helpful for all kids, but especially those with ADHD. Spoke with a dietitian as well, who specifically works with kids with mental health issues, and some of these other resources have been really helpful to look at. So whole foods especially can be helpful for the snacks when stimulants are wearing off, and making lists, getting kids involved by their favorite whole foods or getting parents to model eating whole foods can be really helpful. There was a study that showed in schools, like having an adult that was eating nutritious food in front of kids and modeling that behavior was much more helpful than giving kids information about nutrition and health. So modeling can be especially important. Incorporating more colors into meals is a way to get a variety of fruits and vegetables can be a helpful way. Eating mindfully, we know mindfulness can be helpful in ADHD, and having something to do during that process can be helpful. Noticing textures, eating with others, eating slowly, and chewing well. There was also a study that looked at it takes many times to get kids used to non-preferred food, and often like 10 to 14. So a way to do that would be maybe giving kids a little taste or a lick of these vegetables or things that are less preferred to start. And that usually takes 2 weeks for them to get more comfortable with it, and getting a little reward, like a sticker every day, something like that. There's also an author, Dr. Lisa D'Amour, that looks at kids and more adolescents and habits there. And I really like the phrase where it says, with our adolescents, we want to be mindful of the language that we use, so that you're eating a lot of foods that are really hard on your body and not eating enough of the foods that are going to sustain you and giving you the energy your body needs. So not focusing on the amount, but really on what can be healthy and nutritious. So we're going to take a look at some other studies with nutrition and ADHD and different diets. I'll be going through these rather quickly, as there's varying evidence and not always that practical to incorporate into the clinical practice, but the slides are here if interested. So the first one we can take a look at is artificial food color exclusions. What this looks like is a trial of eliminating food dyes and preservatives. Buying organic, reading food labels, looking for these certain things on the labels. And They have had overall a smaller effect size, but there have been a lot of studies looking at these, but they are quite heterogeneous, where there might be issues with sample selection or imperfect blinding or non-standardized outcome measures. Why this might be helpful, there was one study that looked at the sunset yellow dye challenge, and there was more zinc wasting in the urine. And we know that zinc is an important cofactor in a lot of neurological processes, but this is not known as to the reason why, but some of the things that have been looked at. And another study suggested that maybe in children with ADHD, there are these like histamine gene polymorphisms that might explain their differential response to like having food additives added in. But we also know these effects are not necessarily limited to kids with ADHD, and that can be a lot to ask of parents to limit food color when it's so prevalent in so many different foods. So it's more of a public health issue that if we can reduce the food colors in general, that could make it a lot more helpful. In Europe, there are some countries that restrict food colors, and they have a label. The EU requires a warning label that says there's an adverse effect on activity and attention in children with food coloring. So things like that might be more helpful, thinking of it in a broader perspective, but it can be really hard to do. Taking a look at elimination diets, it's called the few foods diet or the oligoantigenic diet, where you start off with certain foods that are less likely to trigger food sensitivities for a couple of weeks, and then reintroduce one food one by one, see how behavior is impacted. These have had more medium effect sizes, but it's also very challenging to study. Parents have to be super involved. There are no consistent control conditions, and other factors it may influence the results as well, like if medications are on board. So negatives can be that I want to highlight especially that it's can be not balanced nutritionally, and it's kind of the opposite what we'd want to do long term. So being very mindful for when this was used and how it's counseled on. And it would be more helpful if we knew like which patients this might be more helpful with. So learning more about when this might even be considered, about which diet factors and who it might be helpful for is important. There was a study called the INCA study, the impact of nutrition on children with ADHD, was a randomized controlled trial with 100 kids 4 to 8 years old. And the first phase, it was open label, but the clinician was masked. So these measurements were done masked. And this was a 5-week restricted elimination diet. And you can see with the ADHD rating scale and the abbreviated Connors scale that the scores went down with this first phase. The second phase was double blind, where they had these foods that were like low IgG or high IgG food sensitivities, and they added them back in. And it seems like, regardless of what the food was, it seemed like the behaviors went back up to have, more of these behaviors. They found that there wasn't any merit to the low IgG or high IgG, like kids seemed to react similarly, not depending on what their blood showed in regards to that. So clinical considerations about those diets, that it's important to counsel in diet studies and their limitations, that some kids with behavioral symptoms, such as those seen in ADHD, may react adversely to some food additives or certain foods, but there are limitations to the studies, and it should not delay conventional treatment, and it's not the cause of ADHD. It's important to be mindful for when this might be considered, but those that the exclusion challenge might work a little bit better is for highly motivated families who are already wanting to look at diet. They have close medical and psychiatric support. They might have already tried conventional treatments. They're younger kids that parents can really know what they're taking in to their bodies and help them with all of that. And that there's co-occurring issues. Because with the INCA study, they also show that with ODD, those symptoms got better as well with the few foods diet. And you also would want to make sure it's very limited in time, because as we know that it can be, if it's long-term, that can lead to like nutritional deficiencies, limiting your foods that much. So it can really short if they wanted to add all of them in, like few foods diet, the eliminating food dyes and preservatives all at once in those, very, very specialized populations, but that it's not a treatment. is also important to know, because is this more just getting information on what factors might influence behaviors, and that long-term trials should be cautioned against. All right, getting to supplements and ADHD. So we know that American children are not eating well. In fact, there's a lot that did not meet the estimated average requirements. You can see that 94 didn't for vitamin D, for things like DHA and EPA. It's a high amount. And it's not surprising given like the processed foods and the fast foods that are often in the diet. We'll be going through some of these supplements pretty quickly as well, that you'll see that in general, they don't have big effect sizes, if at all. So trying to stick more to the clinically oriented effects. For omega-3 fatty acids, these are one of the ones that are more well studied and seem to have a consistent mild effect on overall ADHD severity. There's this vulnerability to long chain omega-3 deficiencies. That's a theory of what are some of these maybe hereditary genetic factors about why omega-3 fatty acids might be helpful. And that sometimes kids with ADHD showed lower levels given the same oral intake, similar diets. And there was low DHA seen in adolescents with ADHD. So things that they have seen to improve is the emotional self-regulation severity score on a certain study. There's been variable effects, some affected inattention or hyperactivity more. Some studies were negative, but it does seem like there was a lot of heterogeneity. And when the EPA was higher, that was more helpful. And that addition of GLA, which is an omega-6 is possibly helpful as well, but it's unclear if it's due to the EPA effect. As you can see here in a meta-analysis from our Orange Journal, with the higher doses of EPA, the effect sizes went up a little bit. For depression, it's been studied where more than 60% of EPA had a much higher effect size. So overall clinical considerations, the dose might be around 1,000 for a lot of kids. I'm going to make sure the supplements that you choose don't have any toxic things like mercury, and looking for certain labels that can be helpful, that you want to freeze the capsules to avoid fish burps, and side effects can be more GI related, but to use cautiously with bleeding risk, immunosuppression, or medications that lower blood pressure. And here are some recommended brands. This is talking a little bit about the addition of GLA. If anyone wants the slides, they are here. Zinc is another thing that's been looked at in ADHD. There is mixed studies, but a lot of studies do show lower zinc in children with ADHD. There were 2 double-blind placebo-controlled trials in Turkey and Iran that showed zinc to be helpful for ADHD, but when they did a double-blind study in the US, it looked at it did not have that effect. So zinc was what they showed was that zinc augmentation reduced the stimulant dose by 37%, but it was not effective on its own. So when you might want to consider zinc is if stimulant side effects are present and getting to those high doses are harder, or if there's zinc deficiency. These are the frames that were more studied. Safety has been seen in less than 30 milligrams. That's kind of where the studies have shown how much zinc that we're given, and that you'd want to get zinc labs and make sure it's low, and then recheck in 2 to 3 months. Magnesium and iron I'll be going through too, but there's less evidence in these, and there's a lot of heterogeneity between studies. So it's really good to be mindful of publication bias. But it did show that the RBC, the red blood cell magnesium, was shown to be more accurate, and that some of these studies looked at other vitamins in combination of magnesium. So it's hard to pull on its own. And that, ways that we might think it might help with ADHD is that it's needed in dopamine receptor binding and dopamine synthesis and fatty acid synthesis. Something that we see with like zinc, magnesium, omega-3s, there's this mechanism that relates to fatty acid synthesis. And then there was a small unblinded study where they looked at giving kids 200 milligrams of magnesium. But this might be considered if there's co-occurring symptoms like migraines or constipation that magnesium can be helpful for. Those have the most evidence, and checking that low red blood cell magnesium and looking at diet as well. So might want to encourage greens, beans, nuts, and seed where magnesium is found. And here's a little bit of the information of what kinds of magnesium can be helpful and side effects. And of course, wanting to be mindful about medical issues, like kidney issues, and checking drug interactions, like treating every supplement like a medication, making sure you're being thorough about what is all being combined. These two forms of magnesium are much better absorbed than magnesium oxide, which is more likely to cause diarrhea. Iron, a lot of studies looked at iron and that the ferritin level was low in ADHD, but there are some that it wasn't low in. To really want to highlight with this one that up to 44% of children with ADHD were found to have restless leg syndrome. So it's important to screen for that. And if that's there, maybe checking a ferritin level and going from there. Of course, iron is something that we want to make sure that is not taken in overdose and to keep out of reach of children. All right, so going through all of this together, we saw that all of these maybe had a smaller efficacy when each individual nutrient, and maybe there can be a larger impact with a combination. That alone, that these things are unlikely to treat ADHD. So we're making a case it might be worth checking some of these factors if there are some of these comorbidities, checking like a zinc level for some of the things that we talked about, red blood cell, magnesium, and that there are a lot of small studies and not all are rigorous. All right, so putting all of that, what we've looked at together, we saw that kids eat poorly and kids with ADHD eat even more poorly. It sounds like some diet changes can have behavioral effects, and it's unclear why. We saw the Mediterranean diet can maybe affect the gut microflora, and who knows if that's why it's maybe affecting the gut-brain axis. We also saw with kids might have some lower levels of certain minerals, not the best studies, but sometimes even with the best same intake, they can have lower levels of omegas and things like that. And it's not really clear why. Maybe it's a genetic issue. Maybe it's that possible vulnerability to the long chain omega-3 fatty acid deficiency. But now, in addition to their diet, they're even more prone to nutritional inadequacies. So trying each of these diets or supplements is costly, and each of them don't have the best evidence, so may not make a big difference. But we also saw that some of these other factors, like the comorbidities and ADHD, things that are similar to ODD or irritability, that some of these things, like the omegas and exclusion diets, helped with those types of things. So the premise of what if there was something that added all of these small effect sizes together, maybe that would have more of an effect on ADHD and emotional regulation symptoms. All right, so this kind of goes over what we just talked through. And when we, broad spectrum micronutrients, when we talk about micronutrients, what that means is that there are vitamins and minerals needed by the body in very small amounts. And so just going over a question that we can focus on as we go through evidence for broad spectrum micronutrients, which patient might be the best fit for a trial of broad spectrum micronutrients with a clinician with minimal experience working with this modality. Could it be maybe a 15-year-old kid with ADHD, active cannabis and alcohol use, taking Adderall XR with good effect? Maybe an 8-year-old boy with ADHD and ODD has tried stimulants, but that worsened irritability, was not himself on guanfacine. So now he's off of medications and there's no issues taking medication, but now off of medications and having more frequent tantrums and yelling. A 10-year-old with ADHD, depression, significant trauma history, taking methylphenidate, ER, and fluoxetine with intermittent adherence to medication with a busy and stressed caregiver, or maybe a 16-year-old with ADHD and partial seizures, taking lamotrigine and methylphenidate. So we'll come back to this. But looking at the new research, this was in the ACAP journal last year, where there was an 8-week RCT where they looked at placebos and micronutrients, 126 participants. And then they looked at ADHD and also ODD and DMDD symptoms. So patients had to have all of that to meet criteria, and did a really good job with the placebo. It mimicked the scent of the vitamins with a bright yellow color for urine, and that they changed the desiccants. So the vitamins smelled less vitamin E and the placebo smelled more vitamin E. And And so this is the data from that slide where it looks at the clinician rated CGI. And the change was 54% for the micronutrients and 18% for placebo. They were both seen to be effective, like the placebo and the micronutrients and the parent rated CASI-5. And as you can see, both were effective in the parent rated subscales, but they did not separate. So going over the results again, that the blinded clinician results from the CGI scales were 50% global improvement versus 18% for the placebo. For the parent reports, both groups showed improvements, and that the micronutrient group grew on average 6 millimeters more, which was interesting compared to the placebo group, because height is often something that we look at with ADHD treatment. And there was no significant difference in adverse effects. So having less side effects can also be helpful. And that the CGIs, when we're targeting ADHD with DMDD or ODD symptoms, can be hard to treat the overall picture. Or maybe if it doesn't meet diagnosis for a secondary diagnosis, but you just know there's like irritability, some mood symptoms there, they can be really impairing even without a second diagnosis. Some prior history as well, just wanted to have some slides to make sure we have time for the discussion, but that there was another RCT in kids that were pretty similar that was not significant for ADHD core symptoms, but again with the CGI, clinical global index improvement scores was significant for micronutrients. And there's been at least 9 open label studies showing a more robust effect size, and 2 with a crossover design, which showed one of them showed 79% much improved or very much improved. And talking to clinicians that work with broad spectrum micronutrients, they see around 70% there's some improvement. And then there was a RCT in adults as well. So you might be wondering like what these micronutrients are, and this is the label from the one that they used in the study. It's usually an amount between the recommended daily allowance and upper limit of intake, and using specific cofactors to for essential neurotransmitters that could be important for mental health issues. Here are some contraindications that we want to make sure, like overload of any vitamins or minerals would be not good. That can be especially hard to do with other medications. As we see here, a lot of vitamins have significant interactions. So they interact with basically every medication. So yeah, you need someone with experience or can look into this, doing it with a doctor. So patient selection considerations might be things like children with ADHD and significant emotional dysregulation, that it's affordable, motivation of family, and that it's not currently treated with medication due to treatment failure, side effects or preference, and maybe already trialing the first line treatments. Other clinical considerations, wanting to obtain baseline labs and recording those. There are of note 2 new forms in the most studied brands, the Empower Plus and Hardy Done, that do have like a powder form or the sublingual form, but they're not as studied. Their formulations are a little bit different. So the more studied ones are the ones that you take in capsules. There's a clinician reference guide, has been looked at in different types of diagnoses as well, but the most evidence for ADHD and emotional dysregulation. Going over, generally do have what the evidence base is with medications. Like guanfacine does seem to have the most for comorbid ODD, but of course that comes with side effects. And talking to clinicians that use guanfacine alongside broad spectrum micronutrients, they often find that that combination can be helpful. And then broad spectrum micronutrients might be a little bit more helpful, but of course that's just from clinician experience. And so going back to our question, which of these might be a good person to start with for broad spectrum micronutrients? It's the kid where there might be severity that you would want to consider a treatment. They're off medications and have already tried the first line and the indications for ADHD and emotional dysregulation. I'm going to quickly touch too on L-theanine. This is another supplement that's been really helpful in my clinical practice, mostly used more for anxiety. in the son being born is most studied, but there was an RCT that looked at boys and how it could affect sleep. And attention, cognitive processes, and short-term working memory were improved. And so some clinical considerations here can be helpful for anxiety, maybe augmentation for attention cognition, and that it can be given PRN, which is really nice because it doesn't have as much of a sleep effect as some other medications for anxiety, and not as much of a headache, though you do want to be looking for tiredness, headaches, and monitor with blood pressure lowering medications. And anecdotally, in my practice and what other clinicians have seen, that can help with some of the stimulant wear-off symptoms. So wrapping up, that there are other considerations that can be helpful in ADHD as well. And that are, in summary, stimulants have the most evidence in large effect sizes that may not be suitable for all populations. This may be when other modalities may come into play. And there is evidence for some alternatives that are not common yet in current practice, particularly for ADHD and emotional dysregulation, and that nutrition is a modifiable factor that can affect behavioral symptoms as a clinician comfort level in counseling patients in integrative modalities. And the modern physician will need to incorporate the evidence for many modalities for comprehensive and individualized treatment plan. All right, so where to start with all of this? I think starting with our lived experience and honoring your culture and background can be a way to look into integrative psychiatry and creating that sense of connection in yourself. It could be ADHD or it could be for something else, but starting with something that you know leads to healing and choosing one or two of those things that you have experience of building these habits and diving in to learn the evidence base and keep up with it can be really helpful in bringing that extra connection to your work. So that's where I want to leave us off. It's where we can start our discussion. Here are my references. And I want to acknowledge Dr. Amelia Villagomez has been incredible in my understanding of nutrition and broad spectrum micronutrients. The way she uses them in clinical practice and her research has been such a wonderful person to get thoughts from and adopt her nutrition knowledge from. I want to shout out Dr. Jessica Jeffrey, my UCLA faculty mentor and supervisor. It's been so helpful. And Dr. Nosheen Ranjpar, who I will share a little bit more about with right now, where we can get started. All right. So Dr. Nosheen Ranjpar, she is Harvard trained and board certified in general psychiatry, child and adolescent psychiatry, and integrative medicine. Dr. Ranjpar is currently Associate Clinical Professor of Psychiatry at the University of Arizona. She's co-founder of the Integrative Psychiatry program there, while also serving as faculty with the Center of Mind-Body Medicine, the Andrew Weil Center for Integrative Medicine, and the Integrative Psychiatry Institute. Her research focuses on training the next generation of psychiatrists to offer a holistic approach to mental health, while also serving children and families most in need. As a Robert Wood Johnson Culture Health Leader, she continues to expand her work in integrative mental health and in working with the underserved, particularly with American Indian communities, as well as other indigenous communities internationally. Also want to say that I've greatly benefited from Dr. Ranjpar's wisdom and warmth since being a rotating medical student at the University of Arizona. I'm so grateful for 2 years of experience in the integrative track that she co-created. I'm only able to speak clinically about some of these modalities because of her supervision and courage to bring this to an academic center. There's been countless programs that now incorporate an integrative curriculum, and she's a leader in integrative work in child and adolescent psychiatry. You can sense her visionary nature through her accomplishments, but can also see it in her daily work with patients. Dr. Ranjpar would bring in vulnerability and openness and truly partner with patients in a way that I had never seen. Not only that, she's an incredible mentor. I'm so inspired by her close work with working with underserved communities, her guidance in working with asylum seekers. And she truly embodies the change we wish to see in the world through her personal life. Honored to know about her compassion and fostering of refugee children with PTSD. So thankful that she can be here today to kick off our discussion and share some of that wisdom. So Dr. Ranjpar, I invite you to share any reflections on these modalities to start us off.
Thank Thank you, Sneha. I'm so touched by your presentation. There's nothing better in an educator and academic's life than to see trainees go on to do incredible work. And so I'm just really, really proud of what you've done and continue to do. So, gosh, as for integrative psychiatry and broad spectrum micronutrients, it is truly an evolving field. There is so much to learn. I was reflecting as I was hearing your presentation that the first time I heard about broad spectrum micronutrients was in 2009 at a conference in Phoenix. And I have to say, I was exceptionally skeptical because I was like, oh my gosh, here's another product to figure out, the pros and cons and the marketing piece and what does this mean and where's the research? And to think that was 13 years ago, and now we have these randomized clinical trials. And, I have to say, I probably would not have put as much attention on trying to learn them without patients coming and asking and trying them. And it really reminds me that integrative medicine and integrative psychiatry education and training is really trying to meet people where they are and provide safe, effective care. So, the last thing I've ever wanted was for people to buy something out on the market, spend a ton of money on it, and not knowing, what to believe when they hear about the new thing that's going to make their kid, do so much better in school or whatever the situation is. And not tell their doctor that they're using it or waste their money or possibly be taking it at the same time as other things that are interacting and making them sick. So that, my disclosure is that I've really come a long way in learning and growing and recognizing that it, potentially can give us yet another tool in our toolbox, know how to answer people's questions. Now that we have these randomized clinical trials out, there are other companies whose products have not been studied who are, taking the recipe and trying to make their own. But we have no research on, these other versions. And so it's even more important for the next generation of child and adolescent psychiatrists to know what the data is, to know what we're talking about so that people feel safe trusting us to tell us what they're doing. And then to also keep up with the state of the evidence and teaching each other and learning from our experience. So it's been a humbling experience. And I have to say, I utilize them as one of the tools in my toolkit quite a bit now, especially for people who can afford it, which is another whole conversation. And there are some sliding scale programs, et cetera, through these companies that allow for more people to have access to them. Countries like New Zealand have these products now covered by insurance. The US is quite a ways away from that. So those are my initial remarks, and I'm just delighted to answer other questions or be helpful in whatever way I can. Wonderful job.
Thank you, Dr. Anjbar.
Looks like we have time for a couple questions. I'm going to try to prioritize questions from the audience here. And thank you both for this amazing presentation. We have a question coming from a well-known parent trainer. In our parent training clinic, we recommend that parents give high protein or low sugar snacks meals after school to address what they call, quote, the medication meltdown and irritable behavior. Parents report this being helpful during the homework hours. Any thoughts on this, or what are your thoughts in general about this?
I think that a lot of times mood regulation very much has to do with our blood glucose and metabolism. And then you have the added effect of medication letdown or, coming off of the medication that can worsen that irritability period. So I like the idea of a high protein, low glycemic index snack at that time of the day. And as Sneha mentioned, We've also been experimenting with using L-theanine, which is, relatively side effect free and not very expensive, right at that time, like 2 p.m., 3 p.m. when the child is getting off the medication and it's coming out of their bloodstream, and that tends to help a little bit as well. So I think we need more research as usual to really understand, in which cases would one be preferable to the other. But I love the idea of nutrition first before adding supplements.
Thank you. A couple more here. Either of you, any clinical tips on incorporating broad spectrum micronutrients into clinical practice? Like, how do we prescribe to patients and dose in a more sort of logistical or practical frame?
Yeah, like Dr. Venkatraman said, the biggest challenge is the interaction with medications. So it really does require some training and mentoring until people get used to, how to cross taper and how to add and which medications are less likely to have interactions than others. For example, lithium being like the hardest one to add any such thing to, because you can have really significant potentiation effect, as they call it, where the medication just seems to be working a lot better than it ever did before, hence more likely to have side effects, or almost feel like the child is on much higher dose of the medication than they were before when they're added to the broad spectrum micronutrients. So the best cases to start with are on kids who are not receiving medication, because then you kind of get your hands into the clinical work. And generally, stimulants and broad spectrum micronutrients are easier to cross titrate than, say, SSRIs and antipsychotics and all these other, fancier meds out there. And so I do recommend training, and both the companies that have the researched products do have like a clinical consultant that can meet with you and go over the first few cases that you try these on, so you can kind of have support. And then there are also training programs that you can be part of so that you can have mentorship and clinical case conferences, so that you don't feel like you're kind of alone in your neck of the woods trying to figure all this out on your own. But I would say slowly integrating is probably the best, safest way.
Thank you so much, Dr. Ranjbar. And also learned with my work with Dr. Ranjbar that it can be really helpful to do this scale that looks at symptoms of Candida, because having gut health and sometimes, how our gut is currently can affect how well the medications and broad spectrum micronutrients can work. So getting a sense of how a diet is and some of those symptoms that Candida can cause can be helpful from the outset. And talking with Dr. Villagomez and Dr. Ranjbar and other people that have worked with broad spectrum micronutrients a lot, that sometimes they now start with broad spectrum micronutrients if it seems like a kit that would be really this would be really helpful for, and then that kind of gives the basis for medications, and often not as less high doses of stimulants can work more effectively. So making, adding in those building blocks of nutrition, and sometimes that can help our medications work even more well.
Thank you both. As someone that doesn't know a whole lot about this topic, this was immensely educational. So thank you both so much for such a broad and deep overview of this.
Thank you so much, Dr. Ramos, and a pleasure to have Dr. Ranjbar here. Thank you so much.
Take care.